Consumers for Affordable Health Care gathered in Augusta today to discuss its most recent report regarding medical debt. According to the report, of those surveyed, nearly half of Maine households within the last 2 years have incurred some sort of medical debt. 1 in 4 Mainers have more than $5,000 in medical debt. The report adds many Mainers can't afford proper prescription drugs and avoid hospital visits altogether due to the cost. Maine lawmakers also spoke about bills currently being discussed in the legislature regarding medical debt.
We have a chance to improve people's lives. And it all comes down to that basic idea that everyone should have health care. We're a long way off, but that is the path that we need to go down. And no one should go broke because they get sick and have to go to the doctor.
If hospital emergency rooms are seeing more people coming to the emergency room because they can't get health care earlier or they can't get the prescription drugs they need, for example, insulin to treat their diabetes, people end up in the emergency room and the cost of providing care to them is more expensive, and it means that hospitals have to charge more.
Other findings in the report: half of Maine families report a negative impact on their credit scores due to medical debt. 2 out of 3 families experienced adverse financial impacts because of medical bills, and half of Mainers with commercial insurance experienced difficulty affording their deductibles.